Welcome to the Retire Fitter podcast, the physical therapist's guide for retirees to be strong, balanced, and mobile to live the retirement you really want to. I'm your co-host, Nick Rech, owner and physical therapist of Rech Physio in Grand Island, Nebraska. We provide outpatient PT and OT in the patient's home.
And I'm Dillon, Eurek, owner of physical therapist of Strive PT in Omaha, Nebraska. We provide outpatient PT in patient's home. And just a reminder, this is not medical advice. This is for informational and educational purposes only. So please consult with a licensed provider for treatments that are more specific to you.
And if you find value in the show, please share it so we can help as many people as possible. Today we wanted to talk about is back pain and just kind of go through kind of the questions that a physical therapist would ask at your initial evaluation to kind of start to get an idea of how we're going to help you. And so the goal here is to kind of have you understand why we're asking some of the questions and kind of explain what our thought process is when we ask those questions. So Dylan, if you have someone who comes in and they said that, you see on the script, it says back pain, what's one of the first questions you're going to ask when they come to the clinic?
Yeah, and that's that's a loaded question there because we get back pain. As physical therapists, we see back pain. Maybe one of the primary diagnoses and overall patients, very common. So you just want to kind of weed out on how soon, or has it been chronic? So soon, like acute, or is it like from an accident, or just happened, bending over, or has it been more chronic, kind of sore, or it's been bothering for quite a few months and even years. Come across that a lot, and that will kind of gauge the next kind of topics. So I don't know if you wanted me to go into breaking those out, or if you wanted to comment on that a little bit.
Yeah, I mean, if something just happened like a couple days ago, maybe it's something where we could do like a manipulation and it could be a quick fix. If somebody's had pain for months, years, longer, decades, in some cases, you're like, okay, this is probably going to be like more of a stabilization. This is, we're trying to take the edge off. Maybe the goal probably isn't to be pain free. So you're kind of setting your expectations there a little bit if it just happened versus if it's kind of a chronic thing. So,
Yep.
So after that, we'll just say like maybe somebody it's kind of more of an acute back pain. What's kind of the couple questions you'd ask next?
Okay. Yeah. Are we just subjective a little bit more so?
Yeah, just kind of going through the history and the
Yeah.
background, the questions we'd ask, and then kind of explain why we asked that question.
So you'd look if back pain's pretty general. So you'd want to see what side is it on? Is it specific to a region, or is it more specific where you can pinpoint it, finger point right on this area? Like a lot of times we see, sometimes it's the SI joint and they'll go point right on it. So I look for that, and then also want to see him move a little bit. So I'll have him stand up and check motion. I guess I'm getting into testing a little bit. So let me back up. More questions, subjective wise. How did it come about? What made it worse, and what makes it better are good questions I always like to ask to see if and that gives us a mindset on kind of what's helping and what's making it worse, and that kind of gets our minds going there with that question.
Yeah, because that one's can really guide treatment. Because I'll ask like sitting versus standing can really kind of guide what we're going to do with them as far as treatment. Because if sitting feels worse and up and moving around, standing feels better, that kind of tells us that they're not really tolerating the spine bending very much. And so we probably don't want to be doing a bunch of stuff where their spine is bent. We probably want to be going into more of an extension or kind of a back bend type thing. And then kind of vice versa too. If standing and is aggravating and sitting is better, then that kind of knows that kind of tells us a little bit of probably where we're going to go with some of the treatment stuff.
Yeah, that pretty much will guide then I'd want to get in and start seeing her move and test.
Yeah.
Let's see. Is there any other sneaky questions
Well,
you would think about to ask?
the other main one is like, is anything going down the leg or radiating down their legs? 'Cause that kind of tells you some stuff that you you just want to be able to understand. If it's going down to the foot or the knee or the thigh. Because you want to be able to know where the baseline is for those. Because one of the things that we look for with treatment is that as you're working with them, if if you're on the right course of treatment, that pain going down the leg is going to be not going as far down, which is called we call it centralization. Um, and I guess kind of with that, I guess I'll just throw in a little plug. Sometimes you can actually get more intense pain locally, like in the low back, but as long as the pain isn't going as far down the leg, that still means we're on the right track. Which
Yeah,
is
that's a good point. That radiculopathy, a lot of patients have really heard that term sciatica, so you hear that thrown around a lot when it comes down the back. And, a lot of times it's more coming from the back rather than, the nerve sciatica coming, but that's for us to kind of check out. There's, a lot of reasons for that nerve to be irritated, but, low back can definitely be a culprit of that. So yeah, very important to check that numbness and tingling. Sometimes it's pain, sometimes it's numbness, tingling, pins and needles, all that. And then if any other questions, far out, any bowel or bladder changes, when you're involved in the nerves in the back, you want to just broadly scope over some of the, just cross your T's, dot your I's, see if anything comes about from those questions.
yeah. Um, and also I like to ask like what they've been doing to kind of manage it. Have they been going to a chiropractor? Sometimes they'll go to the chiropractor, it helps a little bit, but then it kind of comes back. So then in my mind, then I'm like, okay, I probably don't need to be doing a whole lot of manipulation or mobilization stuff. The chiropractor would have already done all that. I'm probably more looking at strength stabilization, or maybe it's the hip, or something else that's kind of contributing to the back hurting. So I always try to ask, what they're doing, or what they've done in the past, so I kind of know. I
Yeah,
don't want to redo the same thing again. I want to be doing something different, because if that didn't work before, I don't want to be doing it again.
absolutely. And then pain medicine is a thing that a lot of people, patients will, self try to improve, medicate, if you will, or modalities, ice or heat, one of those is helping, one's not, then that gives us a good idea and can guide treatment as well. So, yep.
Yeah. Um, and probably the last one is just if they've had previous injuries or if they've hurt their back before or had previous surgeries. Um, you know, if they have a lumbar fusion or things like that, that's going to kind of guide kind of what we're going to do with treatment as well. So
Yeah,
definitely wanna know
absolutely.
some of that stuff.
The mechanism, yeah, why the back is hurting. Was it from a car accident, a fall? That definitely will dictate where we go with our questions too. And we're not covering every question, and one question will lead to another blanket of 5 or 10 more questions, and because just so our audience knows, there's really a gamut of questions to kind of divulge why we have back pain. So
Yeah.
yeah.
Um, absolutely. So from here, we got a few more minutes here. Maybe you kind of asked the questions you wanted to ask. What do you start with as far as maybe assessing them or kind of going through some sort of a assessment?
Yeah, and I kind of jumped into that earlier. I want to see, movement of the spine, and you kind of touched on that too. We want to see, is it stiff, and that prolonged sitting or sedentary, a lot of sitting, the spine doesn't get as flexible, or movement. Arthritis, people get these diagnoses, degenerative disc disease, and that can kind of freak people out, and it's pretty common, and that's just a diagnosis title, but that can kind of, you know, have stiffness in the back, and that happens as we age as well. So I want to see motion. I want to have you stand up, and if they're comfortable with it, of course, bending forward as far as they can go. And I'm not only seeing how far they can go, but I'm assessing the quality of the motion. Are they leaning to one side or the other? Are they avoiding a certain part in the spine or the back or the hip? So I'm looking at quality from the side. I'll look at different viewpoints of the motion bending forward, and then also bending backwards, leaning back, hands on the hips, and just leaning back in the spine. Um, Checking that lateral bend, left, right, and then also rotation, seated rather than standing, where I can kind of block the hips a little bit so you can get more segmental rotation a little bit. I like to look at it both ways, but that really gives me a lot of intel just from the motion. You you what do you include with that as well?
Yeah, so the that's one of the first things I do as well. Um, if I can, I do like to start with something functional, like maybe a sit to stand or a squat or a deadlift, and kind of quantify that in some way, like maybe a 30-second sit to stand where they do as many as they can in 30 seconds. Or if there's some sort of movement that they're having trouble with, because they'll get that baseline of how they're doing with that functionally, and then as we go through the assessment and some treatment, I want to try to come back to that functional thing and see if what we did treatment wise, if that affected their function. It's called like test retest. I just that's like a something I try to incorporate when I can with patients so that I and the patient can see like what we're doing like helped kind of in real time. So um, but then then I'll go into the motions, forward bending, back bending, side to side. Yeah,
Yeah, check strength, check sensation. Just touch on the skin and see if they can feel it. If there's any discrepancies, you want to kind of see if is a good test for nerves, and then check for asymmetry on strength. A lot sometimes if there's pain going down the leg, you can get associated weakness with that side and or the opposite side. So it's always good to check strength and then manual muscle test there. But yeah, the functional piece is good. A lot of times their quality, like you were saying, really can show what they're avoiding and or why maybe some of the reasons why they're having pain. So
yeah. Um, and
awesome. Yeah, and there's a lot of standardized outcome measures that will add in the evaluation, to get baselines, like you mentioned, 30-second sit to stand, 5 time, sit to stand. All those are timed just to get good baselines. I know we both use that well. And the
yep,
bird balance test.
yeah,
There's
balance, yeah,
numerous other ones, but just to
yeah,
cover a few.
yeah. And as far as the strength goes, one of the most important ones that I look at, I think, um, is the hips, especially the hip abductors or the muscles that make your hip go out to the side. I think that's an important one to check. So um, the extensor muscles are also a nice one to kind of get a strength assessment on, but that the setup, depending on the person, is kind of may or may not work for some people. But strength is definitely a big one, especially in the hips. I think so. I'll look at that. Like you said, the mobility of the spine. Having them lay on your stomach and we're feeling kind of those vertebrae to see do they feel stiff or do they feel pretty mobile. Because your back can hurt because you're stiff, and it can also hurt because you have too much motion, and so seeing how stiff your spine is, that can kind of tell us guide our treatment too. If you're stiff, then we probably need to work on mobilizing it, getting it moving better. If you've got a lot of motion, then we probably need to work on stabilizing that strength piece. Um,
Absolutely. Yes.
so, so like if somebody had weak hips and a really mobile back, that's really telling us, yeah, we don't need to really do any stretching. We need to strengthen and stabilize. So, um,
Yep. Those are good. Do you want to get into chronic, or should we just kind of wrap up here with the some of the assessment for the acute low back pain?
I think the last thing for kind of the assessment that I usually look at is the hips, just how mobile the hips are. Because tightness in the hips can contribute to the pain in the low back. Um, as far
Internal
as
and external rotation. Yes. And
Well,
that's
that's it. Yep.
weaknesses or being too short. Yeah, I find that as well. Now you can test those different ways. It's probably depending on the patient for you as well, on if they can do it seated or if they can do it supine, maybe on the on a treatment table, floor, bed sometimes to
Yep.
assess. How do you
Yep.
assess
I
for
tend to do it with them supine, which is them laying on their back. But
yeah.
sometimes when if I go to a person's house, they if they're especially if they're a taller person and their legs might not swing, or so it just kind of standardize it, makes it easy just to do it with everybody laying down. So
Yeah, the hips, I'm glad you brought that up because they get neglected a lot, even by physical therapists. They're important when you address low back. Sometimes you'll be too tight in the hips too. I find, your quads can affect your back and hamstrings as well.
yeah,
So if those are tight, and we talked about the hips, and those cross the hip, so they're also involved and good to check and include here too. Um, I've had some good success addressing hamstring lengths, the posterior, the back of the thigh leg muscle to address that and really resolve some back pain that
yeah,
way. But
yeah,
like every back pain is different, so it's comes through the questionnaires and then the assessment, and then that really dictates which way we go. So it's not never a one size fits all for back pain.
right. So, and yeah, that's kind of like one of the things if somebody comes up to me, like, somewhere and they're like, "Oh, I have some back pain. Like, what exercise should I do?" I'm like, "Well," it like I need to actually go through about 30 or 40 minutes of questions and assessment to actually really feel like I understand what your problem is. So, um, and if you are going to a therapist and they're just kind of give you some cookie cutter handouts or some exercises without doing much of the assessment, like looking at the things we talked about, that's probably a good sign that you need to try to find a different therapist. So,
Yeah, very good point.
um, but I think that about sums it up for today. I think for the subjective, kind of the questions and kind of our assessment piece. Um, we'll probably in the next podcast get into some of the treatment and things like that. But Dylan, do you have any other last thoughts for today?
Yeah, we kind of just we touched on it there a little bit, but just make sure it's like you say, it's not a quick fix or a simple answer. It's you got to get through a lot of tests and measures, some questions, and assessment to really determine what you need to work on as a patient. It's not your back pain is going to be different than your spouse's or your friends. Potentially, they could be the same, but that's where you want to make sure you get it assessed appropriately. But yeah, we covered that pretty good.
Sounds good. Um, so thanks for listening, everybody. And if you found value in the show, please share it with a friend. If you're in the Grand Island area or Omaha area and have questions, please reach out. My number is 402-641-3176.
My number is 402-990-0143, and I'll strive to be your best. Thanks.